Yes, I can hear you.
Okay. Ready?
Yes. So question 5. Okay. So,
Okay.
a study evaluate a study evaluated the relationship between the common cold and the number of the cigarette smoked per day. The research was conducted among fourth-year medical students and sponsored by the Public Health Department of the medical school. Medical students with symptoms of common cold were interviewed about their smoking status, number of the packs smoked per day, and duration of smoking. All the participants completed the interview and their data analyzed. Based on this information, which of the following is of most common concern regarding the study? What is this? Is it response bias? The only bias I learned is lead time bias. It is. It doesn't look like lead time bias, isn't it?
What are they asking you?
Most concern regarding the study.
Okay, you're reading the question. What in your own words, what are they asking you?
Mm,
Like
They're
what is wrong with it? Uh-huh. Go ahead.
like they are
Go.
trying to make a relationship between the common cold. Like they are trying to make a relationship between common cold smoking status. That is the thing, isn't it? Like
I think they are asking you what is wrong with the study. Do you
oh,
think that's what they're asking you? Like they
no, no,
explain to
I'm
you the study yeah, go ahead. What did you say?
yes. So what's wrong with this study?
Right.
Okay.
Okay. So what do you think is wrong? Or what could go wrong? Or what could go wrong if they perform a study like this?
I don't know. They are responding, so it is not response.
Do you think the response may be they may have, you know, you think it may be admission rate bias, like admission, like the way they selected the patients, or like how many patients?
No, not like that.
Not really, doesn't make sense. Do you think it's lit? You already say
No,
you don't think
no,
it's
it's
lit.
it's not
Yeah.
lead time bias.
Can it be non-response bias? I mean, it says everybody.
It
I
is
mean,
responding. Yes, they are
everybody's
asking.
responding. Yeah. And regression to the mean. I don't even know what that means.
So
I,
it
I
is
don't even.
response bias.
Let's see. It's the only thing that makes sense because the other one I don't know what it means. Let's see. Yep, it's response bias. So the thing is, you need to figure out, not read the question because you can read with the guy that you need in your own words. What are they really asking me? I think that helps.
Yes, true. Okay, response bias occurs when participants in cross-sectional studies, surveys, polls, questionnaires, interviews purposely give desirable responses to questions about topics perceived to be sensitive. Healthy behavior biased response become less useful as they are inaccurate and may lead to incorrect conclusions. lower than the expected prevalence of the disease or frequency of the risk factor. In this example, medical students likely know the risk of smoking and may purposely report smoking a lesser number of the cigarettes than they truly smoke, especially to interviewers from public health department of their institution. These underreporting may significantly these underreporting may significantly affect the results of the study. And non-response bias occurs when the responders differ from the non-responder in such meaningful ways threaten the generalizability of the study result. All participants in this study completed the interview, so there were no respondents. So there were no respondents.
Makes sense. Everything.
Um,
Mm.
can you elaborate something
Like what?
like response bias according to question the
Uh-huh.
where is the wrong in
Oh,
in
the
this
wrong.
them?
They're asking medical students, does smoking they're asking medical students, does smoking cause cold? Gonna make your cold worse, like your flu. Okay, fine. There's another thing. They're asking medical students, um, they want to know if smoking causes cancer. So they go and ask medical students like you and me, okay, how do you smoke? How much do you smoke? And it's the Department of Health that is coming to ask you. You are a medical student, so you already know that smoking causes cancer. Do you think you're going to tell them, I smoke a lot?
No,
No, because you are a you're a medical student, so you're probably gonna lie because you know that already that okay, if I say yes, I smoke a lot, then they're probably gonna think I have lung cancer or I have more chances of getting lung cancer. So you're gonna lie. So your response is gonna be biased. Uh, it's going to be affected by the fact that you're a medical student. You already know that smoking causes cancer. My response to the other medical student response to, so they're going to get fake responses, and then at the end of the study they're going to conclude, oh, smoking does not cause lung cancer because all this none of these students smoke, and all but it's not true. It's because we are lying because we know already what is the truth. We know already that, oh, they're gonna look at us weird. The health department is gonna look at us weird. You know, that's kind of what they're saying. Your response is bias is skewed toward one way because you kind of know something. Does it
yes,
make sense?
yes,
Yeah.
it makes
Mm.
sense.
Yeah.
Okay, next.
Next.
A 5-year-old girl is brought to the office by her parents due to a 3-day history of fever and right ear pain. Temperature is 102 Fahrenheit. Examination reveals a bulging tympanic membrane with decreased mobility. Examination reveals a bulging tympanic membrane with decreased mobility with pneumatic otoscopy, consistent with a diagnosis of otitis media. A recent randomized double-blinded placebo-controlled trial that evaluated the effectiveness of a new antibiotic to treat the otitis media in children reported a difference new antibiotic minus placebo in mean time to resolution of symptoms minus 0.05 days, 95% confidence interval minus 0.085 to minus 0.015 with a difference 3 or more than 3 hours considered clinically significant. Which of the following is the most appropriate interpretation of this study? What they have. Mm,
What are they asking? What do you think they're asking?
that's the thing I am not getting from this bias.
Yeah, it seems like it's okay. But I think that just by doing more questions, you will get, because it's kind of like a pattern. Like basically, they are asking you which of these sentence, which of this statement is true regarding that this whatever design or whatever study that they did. Which of these sentence fits the design, the study that they did? Which one is true regarding the thing? So now, can you give me an answer? Can you try to get an answer?
Mm, this study is clinically significant, isn't it?
Where it says it like here.
Yeah. Oh, sorry. And like confidence interval is it within the range, isn't it? Is there any?
What?
Okay, no. Just don't make it complicated. Uh, okay. Option
Okay.
A or E.
Okay. So we eliminate all the other ones. You don't think none of the other ones are right? We can
No, no.
eliminate
You
them.
start eliminating all the options, like you do.
Okay.
Okay. Like
Okay. Okay. Is there one that you are for sure you know it's not that one, or you
my option is either A or E.
okay, so you've eliminated all the other ones. You know that these ones are not true.
Okay. Yes.
You just say it because you want it. Okay, let's
Like
go one.
what you say, it keeps in my memory. That's why I am asking for. Like how you eliminate the answers.
Okay.
Like I
Okay.
am trying to learn the pattern.
Okay. Okay. I guess let's go one by. Okay, fine. Okay, let's do B since you kind of you're okay. Let's do B. The 0.05 difference in mean time resolution of symptoms is not statistically significant. But we just checked it. Remember, this is the
This is
keyword mean.
mean.
We're not talking about ratio. So what would be our null value? One or zero?
Mean one.
Remember, risk
Yes.
ratio. The ratios were 1/1, and the mean was the difference, so it was 1 minus 1.
Oh, sorry.
Yeah. So what would be the null value
Mean is
here? What's the
zero
null value?
zero.
Zero. Perfect. So if the interval includes zero, then it's not statistically significant. We are not talking about one, we're talking about zero. Okay, so here we have negative 0.05. The interval, does it include negative point 0, negative 0.05? Does it include it?
No.
Wait, what do you mean
Yes.
no?
Yes.
So,
Yes.
yeah, yeah, okay, okay, okay. Does it include zero?
Yes. It includes zero.
No. Does it include, no, does this
Ma
include
oh,
zero?
so both are
It
negative. Sorry, it
goes
does not
zero.
include zero.
It doesn't.
If
So is it
negative to positive, then include zero. Yes.
okay. So is it statistically significant then?
No, because it does not include zero, and we are looking for the mean.
Okay, Omar, come back to me, please. Come back to me, please. Remember when we were talking about one, if it includes one, then it's not statistically significant. If it doesn't include one, then it is
Is
statistically significant.
significant.
So now it's not one, it's zero, because we're talking about mean. And you
Yes,
just say it does not include zero. So is
it
it
is.
statistically significant or is
Yes,
not?
it is statistically significant.
Okay. We're coming, coming back. Okay, come back, please. No, no. Okay, so we know we this is statistically significant. Perfect. So it says that the difference of 0.05 days, it is statistically significant. So perfect. Now the statement, the actual question is also giving you that difference of 3 hours or more is considered clinically significant. They are telling you what is considered clinically significant. Now let's go back to our statement. 0.05 day difference. So this one, time in resolution of symptom is not statistically significant. You just said that it is. So this cannot be the answer, right?
Yes,
We take that off. Okay, fine. The difference in mean time to resolution of symptom is clinically and statistically significant. This is the difference in mean time to resolution they're giving us is 0.005 whatever days. We already know it's statistically significant. You just told me that.
yes.
Uh, yeah, we just told me that. Is it clinically significant?
They are
They
considered as clinically significant in the. Okay,
they are considered okay. So you think this can be true, or what are you saying?
this can be because they have written that this is clinically significant, and we have found that they are statistically also significant because there is um, null. The confidence interval does not include zero, so
Okay.
it.
But they said clinically significant is 3 hours or more. And here we have zero point 0.0 days, day zero
Oh,
point 0.05 days. So how many is zero point 0.05 days in hours? I don't know.
I don't know
Is
either.
it more or is it less? I don't know. Let's keep that, I guess. Let's keep that as a possibility. The time to resolution of symptoms in patients treated with the new antibiotic is zero point 0.05 days. Hmm. So
Is it like
they're telling you that this
possible, like within 0.5 days, the time of resolution of symptoms treated?
I don't think that's not what it says. In mean time to resolution of symptoms is well, okay. But it says the difference in mean time to resolution is 0.0. So the difference between the people that didn't take the thing and the people that they didn't say that it takes them this time, this amount of time to get resolved. They just said that is the difference in mean. So I don't think the statement correctly describes. It's like a play of word here. I
Yes,
don't think this statement. Yeah, I don't think it correctly describes. It just says the mean difference. It doesn't say that's the actual time it takes. So I wouldn't consider it that one. I don't
okay.
know. Now it says there is statistically significant treatment effect that is not clinically important. Hmm. So we know statistically significant is true because we can
True.
see it here. You
Yes.
just said it. But here they are saying that it's not clinically important. So kind of like it's not more than 3 hours. But we don't know how many days equal, how many 0.05 days, whatever equal 3 hours. We don't
Is
know.
there any way of figuring it out?
I don't know. I don't know. I don't really know how to. I don't know how to do. I know one day is 24. So, but
So
this is not even one day. So I don't know. And then
okay.
A, about 95% of patients treated with the new antibiotic have resolution of symptoms in less than a day. So
Mm,
they kind of trying to use that 95. I don't think that's true. This 95 doesn't mean that. It doesn't mean the number of patients
okay.
thing. Yeah. So we are between, I'm between C and D. C and E, sorry.
Okay. Okay.
I think it's E because I think I don't know, I think it's E. I just don't know how I calculated the point 0.5. I just assumed that,
It is less than 3 hours.
yeah, I just assumed that it's less than 3 hours. Okay, let's check. It's
You
E.
were right.
It's E. But at least you have an idea how we eliminated the other
Yes.
ones, right? Okay, now let's read it.
The randomized double-blinded. This randomized double-blinded placebo-controlled trial evaluated the effectiveness of a new antibiotic to treat acute otitis media in children. Acute otitis media in children. The outcome of this study is the difference new antibiotic minus placebo is mean time to resolution of symptoms measured in days. The study reported a difference between groups of minus 0.05 days with a 95% confidence interval for the difference of minus 0.085 to minus 0.015. Because the confidence interval excludes the null value that is statistically significant, the difference in mean time to resolution of the symptoms between groups. One interpretation of 95% confidence interval for the difference is that it indicates that with 95% confidence interval, the true difference is mean time to resolution of the symptoms is between minus 0.085 to minus 0.015. The, this mean time of resolution of symptoms itself is not described.
Stop there. Do we understand everything that we just read? Makes sense?
Not really.
Yeah, you just it's what you just said, the 0 1, so it's statistically
Okay,
significant.
yes.
That part you
That
get it,
part I
right?
understand, yes.
Okay. And then now do you understand what the 95% means? You know why do you understand why it's not A? 95
Yeah,
just means that you are,
95%, yes. Needs the
yeah,
like the confidence interval, yes.
yes. That means that you're just 95% sure of your answer. It doesn't mean that it's 95% of the patient. It means you are this, as the researcher, you are 95% sure that your study is correct, sure that your results are correct. It doesn't have anything to do with the number of patients treated. That's what they're saying. So that's why A is not true. Make sense?
Yes.
Okay. Now you can keep going.
A difference in the difference in mean time to resolution of the symptoms is considered is clinically important. A difference in mean time to resolution of the symptoms is considered clinically significant if it is more than 3 hours. Based on 95% confidence interval, based on 95% confidence interval, the true difference in mean time to resolution of the symptom between 24 into 015 0.3 hours 0.36 hours 0.36 hours and 24 into 0.085 2.04 hours. Okay, that's how they calculate.
You
24
say,
into 015 and 24 into 0.85 2 hours. Okay, therefore the difference is not clinically significant. In sum, based on the study result, there is a statistically significant treatment effect that is not clinically important. Therefore, patient may not benefit from new antibiotic on what considered based on what is considered clinically significant.
Does it make sense now?
Yes, now
Okay.
it makes sense.
So they basically say one day is 24
24
hours.
hours and
So the point zero 0.05 hours is point zero 0.05 times 24, whatever. Sorry, the point zero 0.05 days is point zero 0.05 times 24.
yes,
Yeah. Okay. So next question.
yes.
Okay.
Okay, just give me 2 minutes. I'm coming.
Okay. Okay.
Okay, next. Okay, now,
Mhm.
uh, a, a serum, sorry, a study of serum cholesterol level in patients with diabetes mellitus revealed that the parameter is normally distributed with mean of 230 milligram per deciliter and standard deviation 10. Within the study population, 95% cholesterol observation lie between which of the following limits? Ready?
Mm-hmm.
It's
Go
answer B.
Okay. I think here is pretty clear. You are right. You can read the explanation.
Okay. A normal distribution refers to a symmetrical and a bell-shaped pattern with a fixed proportion of observation. The fixed proportion of observation that lie within a certain distance from the mean. The distance is called standard deviation, and the distance is called standard deviation and measure of the degree of dispersion from the mean. For a normal distribution, approximately 95% of all values within the standard deviation from the mean. In this case, the standard deviation is 10 milligram per deciliter and mean is 230. Therefore, 95% of the observation will be between the 210 to 250 milligram per deciliter. Educational objective. In a normal bell-shaped distribution, 68% of all values within one standard deviation from the mean, 95% of the values within two standard deviation from the mean, 99.7% of the all value within the three standard deviation from the mean.
Okay.
Okay.
Pretty clear. Next.
Yes.
Oh wait, this is from the videos. Do you need me to go over that or you got it? I think you have your own way of remembering this.
Sorry.
I think you have your own way of. I remember you have
Yes.
your own way of remembering this.
You
So
can say in your way. If uh, like you can say in your way, it would be helpful
okay,
actually.
okay, because I don't just don't want to confuse you. But okay, okay.
No, I am not
So
confused.
okay, okay. So from his videos, this is the first he started with this, and he said that sensitivity is the number of patients that has a positive test result. So it will be 25 over the total number of patients that have the disease. So it will be 35. So 25 over 35. So patients that test positive over total patients that have the disease. Specificity, patients that test negative over total of patients that do not have the disease. So patients that test negative over total patients that don't have the disease. PPV with switching. Patients that have the disease over total number of patients that test positive. Patients that have the disease over total number of patients that test positive. So we're not going up and down now. We're going to the whatever. NPV, number of patients without the disease over total number of patients that tested negative. So that's how they come up with that. And then for prevalence, if you want to find the prevalence, is the total number of patients with the disease, so 35, over the total number of patients in the population, so 100. That's how he finds prevalence. Now, he said, what if you increase the prevalence of this whatever table or what is whatever study design to 70%? I will give you this new table. Let's calculate the PPV from this new table. Again, you already know PPV, number of patients with the disease over total number of patients that tested positive. Patients with the disease, total number of patients that tested positive. You will get this. MPV, patients without the disease over total number of patients that tested negative. You'll get this. So if you see, look at here, the PPV for this one, when you increase the prevalence, the PPV increases. I don't
Yes.
know if you can see it. Yeah, I don't know if, yeah, you can see it. And the NPV decreased. So he concluded that when you increase the prevalence, the PPV increase and the NPV decreases. And he said you can remember it with PP. So prevalence increase, PPV increase, NPV decreases. So PP both increase. That's kind of what he was trying to make out of here. And then he made this table where he said that you use sensitivity, a sensitive test to screen for the disease. And then you use a specific test to confirm uh, the diagnosis, whatever, to confirm the disease. And I don't remember how he explained it. I think he said that if the false positive decreases, then the specificity increases. You can find it from this table. I think you have to watch that specific one in the video. But
Okay.
I think, yeah, if the FP decreases, I'm thinking because FP will be part of the specificity. So if it decreases the specificity, yeah, it makes sense, right?
Yes.
Yeah, it makes sense. So, because this FP is the denominator, is the bottom part. So if it decreases, then the specificity will increase. And if specificity increases, the PPV will increase. Remember P and P. That's what he said on the video. Same thing, Fn, false negative. If it decreases, it's in the denominator, so the sensitivity will increase. And if sensitivity increases, MPV increases. Remember N.
And
That's how he said it on the video. So I think that was the main thing on that video that he wanted you to remember. Okay, now next.
yes, a 40-year-old man a 40-year-old man presents to the office with several months of history of atypical chest pain. Our family history is positive for hypertension, type 2 diabetes mellitus. Our past medical history is insignificant. A ECG stress test is performed to evaluate the possibility of coronary heart disease. The test has 85% sensitivity and 2% specificity. In the low risk group, its positive predictive value is 25% and negative predictive value is 96%. If the test is negative, what is the probability that the patient has coronary heart disease? What is like what they are looking for? They are looking for true positive.
Why you say that? I don't
If
think
the
so.
test is negative, what is the probability that the patient has the coronary heart disease?
If the test is negative, what is the probability? And you think that's true? What did you say? True positive? What did you say? Because
I-
that
l-
sounds like
Okay,
that's
then how we will proceed in this question? What we will looking for? What would be our aim?
You need to figure out what they're asking you first. That's the aim. You need to figure out that asking for a true positive, true negative, false positive, or false negative. That's the aim here.
If the test is negative, then it is true negative.
Okay, then calculate it. Give me the answer that you want. That you.
Okay. So we need to figure it out the true negative.
I don't know if this the true negative. That's the thing. You need the key here in this question is you need to figure out what they're trying to ask you. Because once you figure out it's true positive, it's easy. You can calculate the true positive or true negative, whatever. But the key of the question is that you need to figure out what they're asking you first. That's the part that I don't know. I really don't know. Also, I mean, I don't remember that question. If test is negative, so negative test. What is the probability that the patient has disease? Oh, so negative test. So that would be to say the patient don't have the disease. What's the disease? Oh, ugh. So is it true positive? No. Hmm. I have no idea. This one. Wonder.
Um,
Oh,
uh,
I think I know what they're asking you.
are they are asking for false positive?
I think they're asking, given
False
the
positive is 20. Oh, no, no,
negative, if the
no,
test
not.
is negative.
It is not right. Don't.
I think they're asking for. Don't quote me on that. I think they're asking for the negative predictive value. Because
NPV.
look at this. Yeah. Because look at this. That's what he was saying on the. That's why I like the videos from the guy because the videos that you had sent me is like memorizing. But sometimes memorizing, if you don't understand, memorizing is good. Like if they already give you the table, then it's easy to say specific goes down, sensitivity goes up, whatever, and you calculate. But what if they don't give you the table? What if they give you something like that? That's what I like because the guy explains. Because in the video he explained, he said x over y means that x given the this thing, this thing, whatever, this thing right here means given. Um, x given y. And then he was explaining that sometimes in the questions they will give you, like they gave us the thing right here. If the test is negative, so given that the test is negative, so given y, what is the probability that the patient has X? So that's how he was explaining the given. He was like, that's why it's good to understand this by this whatever thing by given. So if you look at it that way, it's like if the test is negative, look at MPV. Test is negative. What is the probability that the patient don't have the disease? So that the patient, yeah, I guess I will take it like that. That disease negative. I guess I don't know. I mean, it makes sense when you look at it, like when you watch the video and he explains it, whatever.
So we
But I
will
think
look
that,
for negative predictive value.
yeah,
But
I
negative,
think
okay, negative predictive value, my answer is like
what?
I calculated negative predictive value.
Okay, so what will be your answer?
Wait, negative
Oh,
predictive value is, sorry, true negative divided by true negative plus false negative, isn't it? And true negative is 80 divided by 80 plus 15, according to me.
okay,
So
so that what will
80
give you?
by 15,
Hmm.
80 divided by 80 by 15, like 95, 80 by 95. Uh,
What's the
so
answer?
one sec.
Patients without
80 divided by 95. 0.84 into 100. Okay. No, not, I'm not right.
You're not. What do you mean you're not right?
Like my answer is wrong. Okay, you
What
calculate
is
it.
what is your answer?
It looks like my answer is 84%,
Okay, so
but it
I
is
guess.
not right.
Mm, I mean, how did you set? Did you set the table or you didn't do
Yes,
it with it?
I say
Okay.
I made the table. Like
Okay.
they told us sensitivity is
Mm-hmm.
85% and specificity is 80%, isn't it?
Specificity is 80%. Okay, so what was so you put for for two negative, two positive, you put what?
Sensitivity, uh, sensitivity is 85%. Like true positive is 85% and false positive is 15 false negative is 15%. Like I calculate,
You said
yes, 85,
85%. Mm-hmm.
yes. And false negative, the lower one, is
Mm-hmm.
15%. This is 15%.
Okay.
And the specificity, I go in that direction like here, 80 and
Mm-hmm.
above is 20.
20. Okay. Okay.
Is
So
it
I'm
right?
getting
Isn't it right?
it should be right.
Yes, I calculated it in this way. Now you told me
Uh-huh.
to figure it out, negative predictive value, isn't it?
Uh-huh. So it will
Negative,
be
yes, negative predictive value is true
people.
negative divided by true negative plus false negative, isn't it? So
So
80 divided by 80 plus 15.
people without the disease, people that tested. Okay. So it will be 80 plus 15, 95. So it will be 80 over 95. Hmm. Something we're doing wrong. I feel like we didn't set the table correctly. Okay, let's look at the answer because I have no idea on that one. The answer is 4. Let's see how they got the 4. Wait, they didn't.
Sorry.
They didn't give a. They didn't give a. Oh, Lord Jesus! They don't have no answer for this one.
So you're right.
Never mind.
Whatever.
No, we're not right. No, we're not right because 85 is not even like
Yes,
sorry,
not
85 is not, yeah. But I don't know why they didn't put. Can we put it on how do you call it? Uh,
you can
Chat
copy
GPT.
it.
Yeah, and you do Chat GPT for that one. Or if not, I'll just get back to you tomorrow once I ask my tutor
Okay.
because he's the one that make those slides, so he knows. Wait, what happened? Why is not coming?
Did you copy
Oh,
in the right direction?
I'm copying. Okay, let's do it again. Where is it? I'm copying, right?
It is
Copy.
not copyable. It is
It's
just
not.
no.
Oh.
It's a like set of picture. It's
Oh.
not the actual words. That's why you are unable to copy it.
Never mind. I'll get back to you tomorrow. I'll ask. Let me take a
I
picture
have
of that.
seen this type of question.
Yeah. I feel like I had the same issue when I did it with him. Let me take a picture of it and I'll send it to he. Okay, perfect.
Okay.
Let's go to the next question.
Next. Okay, you are evaluating a new test for disease X with the following results. What are the sensitivity, specificity, positive predictive value, and negative predictive value? Sensitivity is 70 divided by 70 plus 10, like 70 by 80.
Oh, sorry. You say
Specificity,
7.
yes,
Oh, you say specificity, uh-huh. It's 70.
7. So, no, no.
Oh,
Sensitivity is 70 divided
uh-huh.
by 80.
70 divided by 80. Uh-huh.
Yes.
Specificity.
100 divided by 120.
100 divided by 120. Okay. And PPV.
70 divided by 90.
Sorry. And PPV. Sorry.
Yes,
Mm-hmm.
70 divided by 90.
70 divided by 90. Uh-huh.
And what
NPV.
NPV is 100 divided by 100.
100 divided by, you say 110.
Yes.
Okay. And prevalence.
Number of Total number of population. I don't know.
What do you mean you don't know? You can go back to this. We just did it right here. Prevalence.
The disease divided by total number of population.
So what will it be?
Okay. Okay, it is 80 divided by 200.
80 divided by 200. 80 divided by 200. Okay, let's double check our things. That's all they were asking right there. Okay. So prevalence, you got it right. MPV, right. PPV, right. Specificity, right. And sensitivity, you got it right. Okay, next. I don't think
How?
you have any.
Sorry.
You you have a question there?
No, 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 no question. Only the prevalence. How we have found. I have never found prevalence from 2 by 2 table.
Oh, it's just right from here. But what I number of people with the disease over total number of people in the population. So people with the disease, positive disease, total number of people in the population, 100.
Total number of disease like 25 plus 10, 35.
No, no, people with the disease.
No,
That
look
okay.
at the answer. It is 35, not 25.
Oh, sorry, sorry. I'm sorry. I don't know why I'm pointing that. Sorry, people with the disease. You're right. Over total number of people. Sorry, makes more sense now, right?
Okay.
On does it? You
Yes,
say
yes,
no?
it makes
Okay,
sense. Now it
okay,
makes sense.
okay. Good. Okay, next.
Oh, sorry. Oh, oh, okay. What is you are caring? You are caring for a patient who receives a test with the characteristics below. She says she has positive test result. Ask, what is the chance I really have the disease? What do you say? It is true positive, isn't it? What is the chance I really have the disease?
Uh,
Uh,
it's a beautiful question.
or it is sensitivity.
She has a positive test result, and has a chance that I do have the disease. What do
Or
you say?
specificity.
You're
What
just
is,
asking me everything. You're asking me specificity, sensitivity. You ask me everything.
okay, she has the positive test result and ask what is the chance. So there is specific. This is, I think that this is specificity. What do you say?
Okay, you think it's specificity. I think
And
it says,
specificity is 40 divided by 40 by 70.
okay, so you say it's 40 divided by, you say 40 plus 70?
No, no, just 70, right? Right, 70.
Sorry, 70. I think that is saying that given a positive test result, what is the chance that the disease
Really
is
have
present?
the disease.
So if I go back to my table, it says given a positive test result, what is the chance that I do have? What is the chance that I do have the disease? I think it's PPV.
Okay.
And if it's PPV, I think it is. goodness, where am I?
If it is PPV, then it is 60 by 90.
Okay, you said if it's PPV, it is, I don't know why this my thing is doing this. 60 by 90. So people that have the disease over total number of people that tested positive for the disease. Okay. Now, next question. What if she asks, how often do healthy people get a negative result?
So it is negative predictive value.
So you think it's negative predictive value?
Yes.
Okay, you think it's negative predictive value, so that
So
will be
true negative 40 divided by 40 divided by 60.
40 divided by 60. I think is given healthy people, people with no disease, how often is the test result negative? So, given people with no disease, how often is the test negative? I think it's specificity. Don't quote me on that. I don't know the answer. I don't remember the answer. Yeah. So, if it's specificity, it will be
40 divided by 70.
40 divided by 7. Now, let's check. You may be right. So the first one is PPV, 60 over 90. The second one is specificity, 40 over 70. So I think it's important to know because these questions really, until I understood that given sign, I couldn't answer these questions. And those questions I remember seeing them on UWorld too. So I don't remember seeing them on the exam. I don't my exam is blurry in my head, so I don't remember. But you see, they are easy to answer once you just understand what they're asking you.
Okay,
If it
just go above.
mhm.
Just this part, like this
Which
one,
one?
sensitivity, the positive plus test. This one, this four. Yes. Can you tell me again?
Um, so sensitivity, specificity, we are looking at the test. Okay, put that in here, just the test.
Test. Okay.
Yes. You already know sensitivity is usually is true positive, specificity true negative. You know that part. So sensitivity, we're looking at people that have a positive test over people that have the disease confirmed. So people that have a positive test over the total number of people that have total number of people that have the disease.
Okay.
I don't think you, well, I would prefer if you knew it, but fine. Let's say you don't know all this part. Fine, you don't know this part. You don't need to memorize this. I guess you need to. Fine. Okay, let's just memorize it. They will help for that question. Because I was thinking, okay, let's say you don't know this question, but you figure out that they're asking you for sensitivity. Then it's easy for you to find the sensitivity from the table. But what if you know you but you if you don't know what they're asking you, how can you? Yeah, I guess you need to know. You need to know that. Yeah, you do.
Yes.
Yeah, you need to know. So I guess the key of the question is when they're asking you is if they tell you the patient she has a positive test result, what is the chance that she really have the disease? So given a positive test result, given, that's the keyword, given why, you start by the bottom, given why, given a positive test result, what is the chance that she has the disease? What is the chance that she has X? Given why, what is the chance that she has X? Given this, so they always give you why and they're asking you what is the chance that she has this. So if you already know, for example, that thing that says they're giving you that she has a, what was that, negative test result, you already know you're falling into MPV. because the
Yes.
denominator in MPV is negative test result. And then they say, given that she has a negative test result, what is the chance that she doesn't have the disease? You already know that it's MPV that they're asking you. So you kind of need to, I guess, yeah, you kind of need to know where does
Yeah, we
each,
kind of need to remember this.
yeah, where does each one falls.
Okay.
Now, if it's not that question, then you go, they give you the table, then yeah, you
I
already
can,
know
yes.
that thing. So yeah, so sensitivity, specificity, you start with the test. Sensitivity, test is positive over the total number of people that have the disease. Test is positive, total number of people that have the disease. Specificity, test is negative over total or number of people that don't have the disease. PPV and MPV, you start with the disease. P positive, P positive. So people that have the disease, what is it, disease? People that have the disease over total number of people that tested positive for the disease, so 20, 40. NPV, people that don't have the disease, where am I here? People that don't have the disease over total number of people that tested negative for the disease. So you have to find a way to make it make
Make it,
sense
yes.
in your mind. Yeah.
Okay.
Yeah. Okay. This is helpful if you get these kind of questions where they, but besides that, I guess yeah, it doesn't. I don't know what would be the other utility on that.
Okay.
Okay, here.
Okay, can you give me 2 minutes again?
Yeah.
Okay.
Yes.
Okay. I turned off your microphone.
What
Yes.
do you mean?
Like, okay. In the last call, okay. Leave that topic. Let's start.
Okay. Okay.
Testing characteristics. You are evaluating a new test for disease X. You begin in a population with disease prevalence of 10%. False positive rate is 10%, false negative rate is 20%. How would sensitivity, specificity, positive predictive value, negative predictive value change if repeated in population mm, with 30% prevalence?
So you tell me
Mm,
what would then to be.
we need to draw 2 by 2 table.
Do you
Prevalence 10%, false positive 10.
go back to the thing that we read?
Sorry.
Go back to the table that we.
Yes,
I mean.
okay.
Mhm.
False negative. If false, best. We will tell according to what, like if uh, if there is increase in false positive, what will be the sensitivity? Is that they are asking for?
If there is increase in false
Like
positive.
in here false positive is 10%. If false positive rate is increased or if false negative rate is increased, then what will be the sensitivity? What will be the specificity?
What
Like
are
the
you asking for? Question A or question B? Sorry.
Question
What are
A,
the A? Okay, okay. But question A, they didn't say anything about false positive or false negative. They're asking you about sensitivity, specificity.
like
Look at
how,
the
okay, tell me,
look at the prevalence here is 10.
10%,
Now
yes,
they are increasing the prevalence to 30%.
30%.
So they are asking you if we increase the prevalence, what happens to sensitivity, specificity, PPV, and NPV? That's what they're asking.
Okay, oh, so that thing. If we increase the prevalence, number of the disease, if we increase the prevalence, that means disease status like number of the cases increased.
Look at here. Go back to the look at here.
Okay,
Remember what?
if we increase the prevalence, prevalence is positive predictive value. So increasing the prevalence, PPPV will be increased and NPV will decreased, isn't it?
Okay. Okay.
And if we go like sensitivity and specificity, okay, if PPV is increased, then specificity is increased. If NPV is increased, then sensitivity is increased.
So
So
this
if we go back to that question in
okay.
here, as they are
Mm-hmm.
increasing the PPV, sorry, as they are increasing the prevalence, if
Mm-hmm.
prevalence is increased, positive predictive value is increased and negative predictive value will be decreased.
Okay. Negative predictive value will be decreased. Okay. What will happen
So
to it?
also
Specific
PPV, as PPV is increased, specificity is increased. As NPV is decreased, sensitivity is decreased.
sensitivity is decreased.
Am I
Okay.
right?
What about question B?
Okay. How would sensitivity, specificity, positive predictive value, negative predictive value change in population with the same prevalence with false positive rate and increase false positive rate and decrease false negative rate. Okay, if we do the increase false positive rate, increase false positive. If there is increased false positive, then specificity will be decreased. If there is decreased false negative, sensitivity will be increased.
Okay, let me write it down. What you
Okay,
say? Oh,
yes.
sorry. Where am I? No, no, here. Sorry, I'm here. Okay, so you were saying what will decrease?
If false positive is increased,
False positive
specificity will be decreased.
will
If
increase.
false negative is decreased, then sensitivity will be increased.
Can you do the false positive again? False positive is increased, then what?
If false positive is increased, then specificity will be decreased and positive predictive value will be decreased also.
Specificity will be decreased and positive predictive value. You said positive predictive value will
Value
be.
decreased too. Yes.
I don't know why my thing is doing this. Okay, positive predictive value will be decreased. Okay, and then
And if false negative is decreased, Fn is decreased, so there is increased sensitivity and increase negative predictive value.
Increase sensitivity and increase negative predictive value. What happened? And what about here? What about negative predictive value and specificity?
Negative predictive value will be decreased too.
So
No,
you're
no,
saying
increased. Yes,
here, where
no,
where?
that's all right. We have found all the four things like sensitivity, specificity, positive predictive value, negative predictive value. Yes. What are you
Oh,
looking for?
I thought they were saying if
It,
FP is increased, what happened to all of
you
them?
have to no, that that is
Oh,
not the
okay.
thing.
Oh, okay, okay.
You
I
have
thought you
to
were.
put everything into the equation. Like if we want to find out the positive predictive value, you have to put true positive divided by true positive plus false positive. In here, you will not gonna find the false negative, isn't it?
I don't
You
understand what. Okay. So here so if the false positive increase, we don't need to find
no.
sensitivity and NPV. Okay, got it. Let's look at the answers. So, oh, what happened here? Oh, so here we were trying to find when the prevalence increase. Okay. So PPV will go up, we got it. MPV will go down, we got it. Specificity and sensitivity would not change. So the prevalence does not change the sensitivity and the specificity.
Okay, that's the
Okay.
thing we have done
And
wrong.
then mhm. And then the next ones for if FP increases, specificity will go down and PPV will go down. We got it. If decreases, sensitivity will go up and MPV will go up. We got it. So the only thing we didn't get is this one. That's it. Okay. You got it?
Yes.
Okay, makes sense. Next.
Okay. You are evaluating a new test of disease. You are evaluating a new test for disease X with a sample of 100 patients. Among 60 with disease, 40 positive test. There were 50 patients with positive test overall. What is the sensitivity, specificity, positive predictive value, negative predictive value? I don't know what have done. Disease test, positive, negative, positive, negative. Um, sensitivity, false. Sample 100 patients, 60 with the disease, 60. 60 with disease, 40 have positive test. So 20 false negative. There were 50 patients with positive test. His sensitivity is 40 by 60.
You tell. Okay, you want me to write that? Okay. Sensitivity. You say 40 by 60. Okay. Okay.
How will you calculate the true negative and false positive? Like I have made a 2 by 2 box and they
Okay.
told us that among the 60 with disease, 40 have positive test. That means 40 is true positive, isn't it?
But they have positive tests. Okay. You want me to put it here? Hello? Are
Yes,
you still?
yes,
Okay,
yes.
you
I
want
am.
me to put it
Yes,
here?
yes.
Okay. Okay. Oh, where is this one doing this? Okay. Mm-hmm.
So 20 people do not. 20 people have disease, but it is not test positive. Test is negative. So the 20 should be below, isn't it? Thus, in the below second box,
Right here, you want me
yes,
to put
yes.
20? Okay, 20. Mm-hmm.
Your box is roaming around. Okay,
Sorry. I'm
no problem.
doing it with
You
the
have problem in writing. I
yeah, I'm
don't
doing it
have
with the
problem.
mouse. You
I don't
see?
know why this type of thing is coming. You have used the drawing part, isn't it? Why
Yeah,
these things are
because
coming?
I'm using the mouse. I don't have a pen that I can use.
Okay, no problem. Okay, now I am unable to fix the box. The last two. Why is true negative? Like for they are talking about 100 sample. So 60
Mhm.
with the disease. So 40 without disease, isn't it?
So 60 we did. So 60 will be here, right?
Yes.
Oh, sorry. Jesus Christ. Okay.
Now 40 without disease.
40 with. What do you see? Wait, what did you see? 40 without disease. What do you
Like
mean?
100 sample, 60 with disease. Then the
40
40,
without disease.
yes,
Uh-huh.
isn't it?
So it will be here. That's what you mean. 40 will be here without disease.
Now you divide this 40 into two boxes. They haven't give any clue.
They should have. They cannot give you with no clue. Among the 60 so overall, 50 patients with positive test results overall.
Okay, as they are talking about 50 patients, so 10, write 10 in the false positive and the 30 in the true negative. That's the only thing it made sense. Makes
Okay,
sense.
okay, okay. So here will be 50, and here will be, I guess, 50, right? Am I
Yes,
right? Okay.
yes.
Now tell me, what do you want to do then?
Wow. I have made something that actually makes sense. Okay.
You see, you guys, that means we are doing something right. That's good.
Okay. 30 divided by 30 divided by 40. Specificity
40.
is 30 divided by 40.
Okay.
Positive predictive value is uh, 40 divided by 40 like 50. Positive predictive value is 40 divided by 50 and
Mm-hmm.
negative predictive value is 30 divided by 50.
Value. Oh, you say it's 30,
Divided by 50, yes.
30 divided by 50. Okay, let's check. So sensitivity 40 divided by, oh, let's check our table, sorry. 40, 20, got it, 10, 30, we got it. Specificity 30 divided by 40, PPV 40 divided by 50, and NPV 30 divided by 50. You got it.
Yes.
Yes. Okay. You want to continue? You want to stop here? Up to you.
No, let's continue
Okay, this
because
now that you're getting it, you're like, okay, I'm getting.
no,
Let's
no,
continue.
not because of this, because I haven't studied for
Okay.
since 11 for a long time. I wasted my whole day today. Let's do one to two questions. Then I will
Okay.
think that something I have done.
You've done something. Okay.
Okay, a group of medical genetics
Where are
hypo.
you reading? Wait,
Oh,
I thought it
sorry.
was here. Where am I here? Am I wrong? This one.
So question 5. Okay, let's do question 5 first.
Mhm.
You are evaluating a new test for for disease X. You find a prevalence of 20%, sensitivity is 80%, specificity is 70%. What is the negative predictive value? Okay. Mm, 2 by 2 table basis test. Okay, is it true positive is 80 divided by 80 plus 30? Like I made a 2 by 2 box, 2 by 2
Okay.
table where,
You mean by two table.
okay,
Mm-hmm.
where I put sensitivity into true positive, like 80 true positive and 20 is false negative.
Maybe I don't get it. What is the true positive that you want me to put on the table?
True positive is 80
80. Yeah. Uh-huh.
and the rest 20 is the below second
20.
box. Yes, in
Mm-hmm.
here.
Mm-hmm.
And in true negative, I put 70 in here. Yes, and
70.
above I put 30.
Mm-hmm. Okay. Where you got that 70 and 30? Oh, wait, no, where you got it? I don't want to say oh because I don't.
This one is sensitivity like 80% and specificity is 70. Specificity
Oh, but where you got that two, that 20 and 30? You just,
like 80%, so I put made it 100.
oh, you just made it 100 like that. Okay, okay, okay. So then they're asking you for MPV and PPV.
So PPV would be 80 divided by 80 plus 30
Oh, where's my thing doing that?
and
PPV.
NPV
PPV you say will be 80
80
divided
divided by 80 plus 30
80 plus 30. So that's 80 plus 30. Okay. And then PPV. That, oh, so that's it. That's
NPV
PV.
NPV is 70 divided by 70 plus 20, that means 90. 70 divided by 90.
70 divided by
I think
90.
that I have done something wrong.
Yeah, something is does not make
Oh, yes, they have given us an important thing. We just completely ignored
the prevalence.
it.
Oh,
Yes.
so oh no, yeah, we completely wrong. Okay, so where did they get the 16?
To
So the 20 and 80 are right here. So 20, I guess, is the people with the disease. So the true,
disease
I guess,
prevalence,
positive.
yes.
The true. No, am I wrong? No, I'm
No,
wrong.
no, you
I'm
are
wrong.
right.
That's okay.
This 20
Okay,
is
you
the
explain it.
disease. This 20
Yes.
is, yes, this 20 is
Wait.
disease prevalence. So you made
Mm-hmm.
20
Mm-hmm.
into 80%, that is 16.
Mm-hmm.
So the
So
4, you haven't got my point. They the total number is 20. The 80% of the 20 is the sensitivity, like true positive.
Mm-hmm.
So
Mm-hmm.
20 into 80%, that means 16 should be in
Okay.
the above, true positive.
Okay.
And the
Mm-hmm.
rest 4 would be here. Yes, in here.
The rest will be where?
Below, yes.
The four. Okay. To
Okay.
give 20. Okay.
Yes, it is 20.
Mm-hmm.
Now
Mm-hmm.
the second. Our
Mm-hmm.
prevalence is 20. Disease
Mm-hmm.
prevalence. So without the disease is 80%. So 80
Mm-hmm.
would be in here. Now
Mm-hmm.
this 80, the 70%, 80 into 70. If you do
Mm-hmm.
80 into 70, that is 56. The
Mm-hmm.
56 would be true negative,
Mm-hmm.
and the rest
Mm-hmm.
false positive would be the 24. You got my point.
Oh, makes sense, makes sense, makes sense. Okay, yeah, that was a tricky one. Okay, got it. Got it.
Okay.
Okay. You want to keep going?
No, no, I think that
I think we should
we should
get it.
stop now.
Okay.
If
Well,
we
now I'm worried.
start doing lots of biostat, our head will be going
Okay, but
crazy.
at least I feel like you're getting it
No,
more.
you made me learn so
Like,
smoothly
you
each and every question. Thanks for that because I am very bad at biostat. I know you are very disturbed
no, no.
because
I
because
just,
because I
I
am
just
not
realized.
very yes
No, I just realized that you know the biostat. It's just the questioning because once I tell you this is what they're asking, you give me the right answer. So for some
because
reason
I
I don't know.
tried plenty of time, but the main problem is the initiation.
Yes, yes. But it's like once you got it, that's it. You got it. You you know what to do. Once they tell you, okay, we just need to find the PPV, you already know what to do.
Yes,
But it's like that. It's like getting to that point that is like okay, because if they are not like right here, they're asking you what is specificity scientific. It's easy for you to get it because they are already telling you what is. They're already telling you what they're asking you. But if they have worded that thing in a way that you have to find out if they're asking for PPV, MPV, that's where it gets a little bit tricky for you. But
yes.
I feel like now that we've done all these questions, I feel like even if something